nerves. Published by WordPress.com. Mnemonic for the lumbar plexus. I get lunch on Fridays. I, iliohypogastric, L1, suprapubic. I, ilioinguinal, L1, inguinal. G, genitofemoral, L1 L2, genitalia. L, lateral femoral cutaneous, L2 L3, lateral thigh. O, obturator, L2 L4, deep, med thigh. F, femoral, L2 L4, deep, ant. Thigh. Lumbosacral trunk joins sacral plexus. Mnemonic for the sacral plexus. Some Irish sailors pester Polly. S, superior gluteal, L4S1, up buttocks. I, inferior gluteal, L5S2, low buttock. S, sciatic, L4S3, tibial and common perineal branches deep. P, posterior femoral cutaneous, S1S3, post thigh. P, pudendal, S2S4, scrotum. Several syndromes and conditions can affect the lumbosacral plexus, leading to motor and sensory deficits in the lower limbs. Here are some of the key syndromes associated with lumbosacral plexopathy. 1. Diabetic lumbosacral radiculoplexus neuropathy, DLRPN. Also called diabetic amyotrophy or Bruns-Garland syndrome. CUS, microvascular ischemic damage due to diabetes. Symptoms. Severe pain in the thigh, hip, or buttock. Weakness and muscle atrophy in the proximal leg, often asymmetric. Weight loss. 2. Lumbosacral plexopathy from compression or trauma. Causes. Pelvic fractures, retroperitoneal hematoma, e.g., from anticoagulation therapy. Tumors, e.g., pelvic malignancies like colorectal, ovarian, or prostate cancer. Symptoms. Weakness in femoral or obturator nerve distribution. Numbness and paresthesia in the lower limb. Absent knee or ankle reflexes, depending on lesion level. 3. Postpartum lumbosacral plexopathy. CUS, compression of the plexus during prolonged labor due to fetal head pressure. Symptoms. Weakness in the obturator nerve, adductors, or femoral nerve, quadriceps. Difficulty walking, especially climbing stairs. Sensory loss in the medial thigh or anterior thigh. 4. Radiation-induced lumbosacral plexopathy. CUS, radiation therapy for pelvic tumors, e.g., cervical or rectal cancer. Symptoms. Progressive weakness and sensory loss in the lower limbs. Often painless, unlike tumor-related plexopathy. May develop fibrosis of the plexus. 5. Neoplastic lumbosacral plexopathy. CUS, direct invasion or compression by tumors, e.g., colorectal, bladder, or lymphoma. Symptoms. Severe burning pain in the pelvic region. Weakness in the lower limb muscles, often asymmetric. Late-stage involvement may cause bowel, bladder dysfunction. 6. Idiopathic lumbosacral plexitis, Parsonage-Turner syndrome of the lumbosacral plexus. CUS, autoimmune or viral inflammation of the plexus. Symptoms. Sudden onset of severe neuropathic pain in the lower back, buttock, or thigh. Followed by progressive weakness and muscle wasting in the lower limb. Usually self-limiting, but recovery may take months. 7. Obturator nerve entrapment syndrome. CUS, compression due to pelvic surgery, trauma, or tumor. Symptoms. Groin or medial thigh pain. Weakness in hip adduction. Sensory loss over the medial thigh. 8. Piriformis syndrome. CUS, compression of the sciatic nerve by the piriformis muscle. Symptoms. Buttock pain radiating down the leg, mimicking sciatica. Worsens with prolonged sitting. Tenderness over the piriformis muscle. Exaggerating by IR.